the Honourable Jean Atherton, JP MP, Minister of Health, Seniors and Environment, event organisers, vendors, invited guests, ladies and gentlemen. On behalf of the City of Hamilton's Council, it is my pleasure to welcome you all to the steps of City Hall. Today, we observe the global celebration of World Health Day with a special emphasis this year on diabetes. I would like to applaud and congratulate the Bermuda Diabetes Association for the continued work they do raising awareness, education, and to help treat diabetes in Bermuda. The hard truth is that diabetes is a reality for too many Bermudians and their families. It is occasions such as this that we can provide opportunities to highlight the benefits of living a healthy lifestyle and explore other preventative measures to ensure that our community has the tools it needs to combat this disease. There are currently 350 million people across the planet that suffer from diabetes, and the sad reality is that for the next 20 years that number is expected to double. With heightened awareness, education, it is my hope that we can reverse this trend and begin to see those numbers decrease. I encourage everyone here today to look over the information on hand so that the steps we take will be educated ones, especially for the most vulnerable in the community, our children. Knowledge is, after all, power. Again, welcome to City Hall, and please enjoy all that is on offer. I'd like now to welcome the Minister of Health, Seniors and Environment, the Honourable Jean Atherton, to the podium. Thank you all.
Good afternoon, ladies and gentlemen. As the Minister of Health, Seniors and Environment, I am very pleased to be here today as we celebrate World Health Day. In preparing my remarks, I was reminded that one of the objectives of celebrating World Health Day annually was, and I quote, to motivate the World Health Authorities to make their own efforts in creating healthy environments in their country. I reflected on whether we were achieving this here in Bermuda. I listed amongst our ongoing efforts a vision, healthy people and healthy communities, the Bermuda Health Strategy 2014 to 2019, which established priorities for Bermuda's health system reform, and the Bermuda Health Action Plan 2014 to 2019, and I believed we were on the right path. When I examined the theme for World Health Day 2016, which is diabetes, scale up prevention, strengthen care, and enhance surveillance, I was further encouraged. As part of the health priority items in the Bermuda Health Action Plan is to develop a chronic disease register, decrease the acuity of illness related to diabetes via education and appropriate clinical services, and halt the rise of obesity and diabetes in Bermuda. Having addressed the Well Bermuda National Health Promotion Strategy meeting in January, I knew that Bermuda had begun the process of creating Bermuda's first concerted effort to create a joined-up approach to the promotion of health on our island, and to create a shared vision for health promoters across all sectors. Today represents the partnership, collaboration, and participation which is required to create good health in Bermuda. What is also required to create good health in Bermuda is our individual commitment to be part of the healthy people in healthy communities. Ultimately, we know that health is absolutely essential to any community. Without health, we perish because children cannot develop well and hit all their milestones to set them on a strong, prosperous path. Without health, adults can't raise families and care for their eldest. Without health, our golden years tarnish and easily turn into a harrowing decade or two of revolving doors of healthcare institutions with a quality of life that is not deserved by anyone. We need health, and we need all of us to turn Bermuda into a community filled with healthy people. Changing our culture is so that healthy choices become the easier choice more often for more people will take a concerted and unified effort from all of us. Everyone makes an even bigger difference than when we're all aiming for the same target. This event provides an excellent opportunity for all of us to commit to change. Today, let us consider our approach to personal health. What are we doing right? How can we improve? Are we eating the right foods? Do we drink sufficient water on a daily basis? Do we get enough exercise? Let's be honest with ourselves. And don't put off until tomorrow what we should have done yesterday. Are we truly taking care of ourselves the way we should? More awareness is needed of cause and effect. So please visit the provider partners here today and have them explain which illnesses are caused by lifestyles which you can change. The Department of Health's goal this year is to reduce non-communicable disease and to halt the rise in diabetes and obesity. Diabetes is a chronic disease and very prevalent in Bermuda, far too prevalent for an island this small. We can reduce the risk of diabetes and we can control and manage it if we properly assess our lifestyle and make the necessary changes for better health. This is an ideal opportunity to evaluate our habits and to take steps to prevent diabetes and other chronic diseases. I encourage everyone to become advocates for better health. On behalf of the Ministry of Health, Seniors and the Environment, I would like to thank the Bermuda Diabetes Association and our partners, and all of our partners here today. We are encouraging residents to commit to change by choosing to drink water, exercise daily, and eat more vegetables. Before I close, I want to mention something I heard today on the news. Health advocates are suggesting that in addition to the calorie information that is put on labels, there should be an activity equivalent calorie information on the label, which would tell the buyer how much activity it would take to burn off the calories they will consume. It is interesting because the reason I found this interesting is because it will still take our personal choice and commitment to either change our eating habits or increase our exercise. Let's truly commit to change and let's get a better, healthier Bermuda. Thank you.
The Honorable Minister of Health, Seniors and Environment, Mrs. Jean Atherton, the Right Worshipful Mayor, Charles Gosling, friends, colleagues, Bermuda Diabetes Association, I just want to thank everybody for being part of today. It's only that if we can work together can we make a change. For those of you who don't know, the Diabetes Association started almost 40 years ago. 40 years ago, we didn't have this epidemic. We have an epidemic that is beyond our control, and it's only together that we are going to be able to make a difference and turn it around. So I want to thank each and every one of you for making a commitment today to come out to support us and be part of this. But I also want to say on behalf of the Bermuda Diabetes Association that we are here for you, and that one of our key aims is to help people in need. And for those of you, and many of our people in Bermuda are in need. They have financial needs that aren't being met. And that's one of the mandates of the Diabetes Association, is to help people. So if you are in need, please go to the Resource Center on Beacon House. Let us help you. That's what we're here for. And again, thank you. I want to introduce Sarah McKittrick, who's our educator, and she will talk about our Commit to Change.
Thank you very much. Just to make this a very simple but exciting introduction today, it's World Health Day, with the focus today from the World Health Organization on Beat Diabetes. And the Bermuda Diabetes Association, in conjunction with the Department of Health, is really excited to roll out our campaign, Commit to Change, as the Minister of Health introduced. We are calling everybody in Bermuda to take action in specific health behaviors which will reduce your risk and step up our battle in the prevention of diabetes type 2. And our commitment to change in health behaviors based on 3 very simple areas. And you'll see here to my right a Commit to Change poster, which we invite all of you to sign to commit that change pledge today. The 3 specific health behaviors we're calling to people to commit to change: to drink water, to exercise daily, and to eat more vegetables. Simple but very effective means that help us to fight the war on the prevention of type 2 diabetes. So we invite you now, and we're introducing to a pledge that we're all going to recite, to look for that. Come out and sign our poster today. Thank you very much.
Good afternoon. Commit to Change pledge. Today, we invite you to commit to change for a well Bermuda by working towards a healthier lifestyle that will benefit ourselves, family, friends, and ultimately our community. Taking control of our health will not only contribute to the efforts of halting the rise of obesity and diabetes, it will also provide us with a better quality of life. Begin the journey today by pledging to commit to change, by taking 3 simple steps for a better you. 1. Choose water. It is healthy, affordable, and quenches thirst at any time. It has no calories, contains no sugars, and is necessary for the body to function. 2. Exercise daily. It is the miracle cure we've always had. But for too long, we've neglected to take our recommended dose. 3. Eat more vegetables. Vegetables help maintain a healthy weight, prevent disease, and provide a variety of nutrients. Commit to change today by pledging for a better you. Please repeat after me. I pledge to choose water as my everyday beverage. Exercise daily by seeking everyday activities that help to increase body movement. Eat more vegetables by incorporating them into more meals and snacks. Today, I commit to change by taking these simple steps for a healthier me. During this journey, I will set the example and encourage others. As I take care of my body, and it's the only place I have to live in. Thank you.